Hello and welcome. In this video, I will be exploring the 7 items typically included in agenda setting in therapy, comparing 2 video demonstrations of this, and discussing 3 potential difficulties new counselors might face in this context with potential strategies they might employ to address these. Part 1. The 7 items of agenda setting. These are a brief review of the events of the past week, a brief review of the past session, assessment of the client's current mood, a review of the homework, the session's main topics for discussion, homework, and feedback. So the first agenda item we will consider is the brief review of the events of the past week. Here, the client is asked to offer a general outline of their past week, with any potential new agenda items being identified. An appropriate level of detail for this can be modeled by the therapist through summarizing what the client has expressed. In the Dr. Grande video, he does begin right away with a check-in with how the client has been doing over the past few days and briefly summarizes the key themes from what the client shared. In the Quality of Counseling Services or QCS video, the client is asked about their mood over the past week. Later, they're also asked about their experience during the week more generally and whether there's anything from the week that they would like to discuss, issues in particular. So this agenda item is present in both videos. Secondly, we will consider a brief review of the last session. So another item is to review the last session. This might include expansion into areas of interest or addressing any potential problems with had occurred in the last time. The way the client approaches this item can offer additional agenda items. For example, if they can't remember what had occurred the last time, or if they're clearly telling the therapist what the therapist wants to hear, these are things that can be addressed later on in the session. In the Grande video, the previous session is reviewed. The impact of the previous assigned homework is reviewed during this time. In the QCS video, the previous session and the client's last Beck Depression Inventory Assessment is addressed early on by the therapist. And later on in the session, the therapist invites the client to share what resonated with them from their last session. So present as well in both of the videos. Next is the assessment of the client's current mood, either formally or informally. So the former formally might be done using the Beck Depression Inventory or the Beck Anxiety Inventory. Informally, the client can simply be asked how they're feeling, for example. Optionally, the client can rate their overall mood over the past week on a scale of 1 to 10, ensuring to label the polls with statements such as 1 being problem-free and 10 being the worst possible. You can tailor these polls to the client's experienced emotions, ensuring to take notes of whatever scale, whatever method you end up using. In the Grande video, Dr. Grande asked the client about their feelings over the past few days. He directly asked the client if the client is feeling okay. And the client expresses feeling overwhelmed and later anxiety. In the QCS video, the therapist does ask the client how their mood is, both currently and over the past week, asking them to rate their emotion on a scale of 1 to 10. So again, this item present in both videos. Next, a review of the homework. So with high potential for overlap with other items, a discussion is prompted about the client's experience with their homework from the last session. Due to negative associations with the word homework, however, other terms are often used instead of homework, for example, projects, tasks, behavioral experiments, or even just giving specific task descriptions. In the Grande video, the previous homework is reviewed while discussing the previous session, whereas in the QCS video, this item is absent. The next agenda item is the session's main topics for discussion. So this will be informed by both previous sessions and the ongoing one. The main topic of discussion are addressed, potentially overlapping with other agenda items. This might include working on CBT skills such as understanding the role of safety behaviors in perpetuating issues or identifying negative automatic thoughts, exploring external issues such as with relationships, or discussing symptoms such as moods, cognitions, or behaviors. In the Dr. Grande video, the therapist follows a client-centered approach, asking the client what is on their mind and what they would like to discuss today. Additionally, he asks the client to home in on which issues seem to be the most significant and debilitating to collaboratively decide with the client what will be discussed. In the QCS video, the therapist draws upon the review of the past week for themes and introduces an agenda item that they believe would be helpful for the client. The therapist identified the main topics for discussion on a whiteboard throughout the video, and the client is asked what the main topics should be. The homework item of the agenda involves tasks that the client is asked to engage in between sessions that are chosen collaboratively. This can take up to 10 minutes. The Grande video concludes with the mention of developing tailored homework for the client, while in the QCS video, the client actually brings up the homework, to which the therapist mentions that there will be action-oriented homework involved. So this item is present in both videos. Next is feedback. So the final agenda item considered here is feedback. During the feedback portion, the client is given the opportunity to share their experience of the session. It's important to ensure that enough time is allocated for this. In the Grande video, he invites the client to offer feedback about the agenda they are setting. Dr. Grande included all 7 items in the agenda setting process in the video. In the QCS video, the therapist begins the session by briefly describing the course of events, including agenda setting, before inviting feedback from the client about this plan for the session. Later, they ask the client if there was anything from the last session that irked the client or that they had wished that they had expressed. And near the end of the video, the client is then asked for feedback on the agenda that had been decided together. So feedback present in both videos. Part 2, my preference for style. So although both approaches included roughly the same agenda items, there were important differences in how these items were included. The first thing to notice in each video is the setup, including the environment and how the participants, therapist, and client are positioned within it. With the Dr. Grande video, the decor seemed outdated and Eurocentric. According to the American Psychological Association, or APA, guidelines for providers serving diverse populations, therapy spaces should affirm and respect the cultural identities of all clients. An office with outdated Eurocentric decor might signal to clients, especially those from culturally diverse or marginalized backgrounds, that their own cultural experiences are undervalued or even invisible. This can lead to discomfort, mistrust, and a reduced willingness to engage fully in therapy. Clients may feel that the space reflects a one-sided worldview, potentially increasing feelings of alienation and impacting the therapeutic alliance. In effect, such decor could act as an unattended microaggression, undermining efforts towards culturally responsive care and negatively influencing treatment outcomes. What was working well in Dr. Grande's environment in the video was that both the client and the therapist were sitting at eye level and face-to-face from one another, as this setup can help lateralize the inherently imbalanced power dynamic between therapist and client. Though this might be less appropriate when working with certain cultural contexts, for example, those with different norms around eye contact. In contrast to this, in the QCS video, the counselor is towering over a seated and cornered client who are separated by a whiteboard which the therapist is using. So unless the therapist has a legitimate reason to be standing, it'd likely be more appropriate to match the client's seated position to lateralize the power imbalance. Additionally, the whiteboard is serving to, unless the whiteboard is serving to address the specific needs of the client, this setup is concerning as it might reinforce the power imbalance, frame the therapist as the expert, and reduce face-to-face interactions. Dialogue in both videos is initiated by the therapist at the beginning. However, Dr. Grande begins with an open-ended question about the client's mood, immediately inviting client participation, while in the QCS video, the therapist begins by getting right into telling the client what is going to happen, and then simply ask the client a yes or no answer of whether or not they're all right with the course of events. As the video continues, Dr. Grande continually asks many open-ended questions while displaying active listening throughout. The client spends a lot of time during the agenda setting session sharing their experience and issues. In contrast, in the QCS video, the therapist spends much more time speaking than the client and asks mostly questions that are easy to answer with only one word, not really giving the client the opportunity to participate more fully in the session. Overall, Dr. Grande's approach seems more Socratic, guiding the client to make conclusions based off their own knowledge. Part 3, common agenda difficulties. So one common agenda difficulty that might be encountered by new counselors is cultural competence and potentially underestimating the client expertise. So clients have unique diversities, unique intersectionalities that need to be considered. So one strategy that therapists can employ to avoid this is to take on a more person-centered approach in their counseling, where the client is given a greater opportunity to provide their own values to the session. For example, in goal setting more collaboratively during agenda setting, it would be less likely that dominant cultural values might inappropriately take precedence over the client's. This strategy lends itself to my open-minded personality and person-centered style of practice. Should a client's values be inadequately respected, this can lead to oppression and ruptures in the therapeutic relationship. Should such a rupture occur, the therapist must validate the client's experience while addressing and exploring the rupture collaboratively to seek repair. Another challenge faced by potential new counselors in agenda setting is having trouble prioritizing the client's issues effectively. So clients may sometimes feel overwhelmed by multiple concerns and might have difficulty identifying which issues are the most critical to address. This ambiguity can hinder effective agenda setting and reduce client engagement. One strategy to overcome this challenge is to use a collaborative agenda setting approach, as mentioned earlier. For instance, the therapist might ask, what are the top 3 issues you'd like to focus on in our sessions? This open-ended inquiry helps clients reflect on and prioritize their concerns while fostering meaning-making and engagement in the therapeutic process. Research suggests that a collaborative agenda setting can improve treatment engagement and outcomes. In the Dr. Grande video, the client is asked, for example, to prioritize which issue they would like to engage with, using a person-centered approach to help determine which issue to focus on. The final challenge that new therapists might encounter in agenda setting is balancing structure with flexibility. So we saw the Dr. Grande video was a little bit more flexible, where the QCS video was a little bit more rigid with more structure. So how do you strike the right balance there? If you're too rigid, that might stifle spontaneous discussion and the client's ability to offer their own values to the table, whereas too little structure might lead to aimless and unproductive sessions. So for these reasons, you want to strike a balance. Have a semi-structured approach can be a helpful strategy. So for example, therapists can collaboratively develop an initial session agenda and then regularly check in with clients to adjust it as new issues arise. This dynamic approach fosters a robust therapeutic alliance and ensures that both planned and unexpected topics have the opportunity to be addressed. Thank you.